So good morning. So, as I said, this session is dedicated to one of my friends in Dubai, and he has taken subscribe to the Strive to Thrive program, which is the personal coaching for back and joint disorders. Okay, so before we get into the exercise part, let us understand what are the reasons that why we get this neck and shoulder pain, and what is the reason that arthritis is so common these days. So let's focus on the neck and shoulder part first. So I made a list. I'll just explain you that what's the reason. One is poor posture. I'll explain you today what the posture should be, so that those who don't have this problem will never get it, and those who have, they can correct it themselves. So poor posture means sitting and standing both. We will learn today what is the right posture. Second is wrong use of gadgets or devices. So most of us today, because there are like gadgets everywhere, either cell phone or laptop, we are on our devices most of the time. The angle at which we use these devices can cause a lot of strain on the neck. So we need to be very mindful of how we are using our gadgets. Third is sleep apparatus. So sleep apparatus includes your bed, the bed on which you are sleeping, and the pillow you are using, and the angle also. At what angle do you sleep can also cause neck issues. Fourth is degeneration of the spine. So if you are not taking good care of your body since childhood, there will be a lot faster degeneration of the spine. A part of it is related to aging also, but as I believe that we can also reverse that. So this program is all about reversing your the Forever Young program that I'm doing. It's all about reversing your biological age. So sometimes if the degeneration happens in the spine, that also can lead to neck and shoulder pain. With this loss of muscle mass. So as we discussed a few days earlier, sarcopenia, which is the loss of muscle mass as we age. That is also a reason because your muscles support your cervical. There are a lot of muscles, the trapezius muscle. I'll come to that later on. What is trapezius muscle? Because that is one muscle we need to address if you want a stable shoulder and neck joint. Okay. So if you have weak muscles, you will get pain. And last but not the least, stress. So they say you carry a lot of weight on your shoulders. So if you try to multitask, if you are a go-getter, if you work 8 days a week, you are bound to have neck pain. Okay, so you need to be very careful about managing stress, taking frequent breaks. So as I said, there is something called as the ultradian rhythm in our body, which means that every 90 minutes we should actually take a break of 20 minutes. So this may sound a lot, 20 minutes. So let's start with like 2 to 5 minutes break every 90 minutes. Just give yourself a rest. I'll explain you what to do. Every 90 minutes, just close your eyes and certain breathing practices we will do. That will help you oxygenate. So now the solution. So this was the reasons. Now the solution. So what we will do, if the problem is wrong posture, we need to correct the posture. We need to strengthen the muscles. We will learn which pillow to use, how to sleep. We will learn certain asanas to correct your posture also. And the degeneration that may have happened because of certain wrong practices or aging. So that's a long process. So that may take a few months to a year also. How do you like stop that first, stop the damage that is happening, and but going forward, how do you reverse that? Okay, so before we start with exercises, we need to, I'll show you the sitting posture first. How do you sit? So I'll just change my angle. You don't, you just keep looking at me first. Don't do anything unless I see. Okay, so see, I'm sitting this way, and you can see my neck is protruding. It is slightly in front, and my shoulders are drooping this way. This is the way most people sit these days, and this is one of the reasons you get a stunted back. So your height keeps reducing as you age. So what's the right posture to sit? You just lift yourself up from the core. You just lift yourself up from the core. Take your chest slightly out Main thing is roll your shoulders back. Can you look at the difference? First, I was sitting this way. Now, I'm just coming up, just rolling my shoulders slightly back. So your shoulder blades will come closer to each other. Your shoulders back, chest out. And this is the way your sitting posture should be. Now you can show me, everyone. Just turn. Yeah. So this is I have a group today with me who are like training live. So you can just turn and show me how will you sit. Just everybody give me a side angle if possible. Yeah. Yes. So just lift your shoulders a bit, roll it back, chest out. Chin should be parallel to the ground. This is the way you will sit. Great. So, Pooja, you are lifting your shoulders a bit. Just drop your shoulders. Don't put stress on your shoulders. Yes, Dolly, right? Dolly is also perfect. Priya, can you turn your camera slightly down if possible? Your camera is up. I cannot look at your shoulders. Yeah. Yes. So, this is the way you sit. Right. Now, you can just look at me. Just turn your neck and look at me. Now, we are going to learn the first exercise to correct our alignment of the neck. So, what you will do, like Michael Jackson did, okay, so this is the, I would say, pressure off position. Okay, to pressure on, what you have to do, you have to tuck your chin in. Don't look down now. Okay, just tuck your chin in, bring your chin to the throat, keep looking forward. So this is pressure on, and when I say pressure off, you just relax. Okay, just a sec, once again, pressure on, pressure off. So if this is too much, you can hold just for 1 second also, this way also. Pressure on, pressure off, pressure on, pressure off. So you'll naturally feel some tension in this part of the neck. But what this is doing, this is placing your head on the spine. Right now, what is happening is my cervical and spine are not in alignment. So I'm just pushing it back, putting some slight mild stress on this part. You may feel right now. You may experience slight pain also. That is normal. But try doing this. And what you can do in the going further, just push it with your fingers this way. So place your fingers on your shin. When I say pressure on, you just push it back, pressure off, pressure on. Everybody start with the fingers, four fingers, not one finger. Yeah, pressure on, pressure off, pressure on. You can make notes later on, Dolly. Yeah. Just focus on doing the practices. Pressure on, pressure on, pressure off. You may feel slight shivering also in your neck. That is quite normal. One last time, pressure on and pressure off. Just relax. So this is the first. So this is the Mackenzie method. Actually, this is the Mackenzie method, which has been in practice since 1956. So earlier, a lot of people used to have issues. They used to take painkillers and go to physical therapists. That didn't work. So Robert Mackenzie, I think, if I remember the name correctly, I'm following him also, and this has worked for me and my past clients and patients who have come to me with neck issues. So this is the number one exercise that we can do. Second exercise is retracting your neck. So what retracting means is, so you just take your chin up. Okay, first take your chin up this way. Just look at me once. Take your chin up. Then you move your nose slightly, only half inch to the right. Come back to center, then half inch to the left, come back to center, back to starting position. Okay, so we will do it together. First, correct your posture. Okay, so Pooja, your shoulders are drooping again. Shoulders back. Okay, so everybody take your shoulders back. Place your hands on the thighs, elbows close to the body. Inhaling, take your chin up as far as you are comfortable. Sorry, comfortable. Now just take your nose half inch to the right, half inch. Come back to midline, half inch to the left. Come back to your midline, down to center. I'll just correct you now. Everybody start once again. Start and I'll correct you. Look up. Yes. Half inch to the right. Yes. Come back to midline. Half inch to the left. Come back to midline and down. Great. So we can practice this 3 to 5 times for a start. Okay. So we'll do this 2 more times on our own. I'll guide you. Okay. So just be mindful of your posture, your shoulders. Let's do with breathing this time. So inhaling, take your chin up, do normal breathing. Half inch to the right, nose, come back to midline. Half inch to the left, come back to midline, down to center. So when you come down, you exhale. Okay, 2 more times. Inhaling up, half inch to the right, midline, half inch to the left, midline, exhaling, down. One last time. Inhaling up, half inch to the right, midline, half inch to the left, midline, exhaling, center. So one thing we will do, we will never look down. If you have any cervical issue, avoid looking down a lot because it will again put a lot of strain on your neck. So now you must be feeling slight strain. We have done so many exercises. So just lift your shoulders up and rotate. This is an excellent way to relax your cervical spine. So your cervical spine, as I said, is supported by your trapezius muscle. I'll show you what is trapezius muscle. So this is one exercise to relax your trapeze, traps. We called it the traps. Now repeat opposite side, roll from behind. So this you can do in your ultradian rhythm break also. So when you take a break every 90 minutes, just do this simple, only one exercise. Just lift and rotate. So you'll naturally start feeling better. Okay. Next exercise for neck, we will do twisting. Okay. So while twisting, since you have strain in your left side, don't push yourself too much. Okay. We will go very slow. It's not a sprint, it's a marathon. So we have to be mindful of our bio individuality. Okay. So I may be able to do more or less, do as per your capacity. Inhale on the spot. Exhaling, look to your right. Inhale, center. Exhale, left. Inhaling, center. Once again, exhale, right. Inhale, center. Exhale, left. Inhale, center. Now we will just add one variation to this. First, look at me. So inhale on the spot. Exhaling, look to your right. And then inhaling while looking at your right, you look up. First, exhaling down. Inhale, center. Exhale, left. Inhale, look up while looking to your left. Exhale down. Inhale, center. Exhale, left. Inhale up. Exhale down. Inhale, center. Exhale, left. Inhale up. Exhale down. Inhale, center. And just close your eyes for a while and just feel the circulation in your neck, in the muscles of the neck. And just visualize your neck muscles freeing up. Your pain is diminishing, reducing, alleviating. Just feel the flow of blood. Once again, we will just lift our shoulders and rotate. So neck exercises are always to be done very slow because it's a very sensitive muscle. Come back, change. This is a very sensitive area of our body. It's a very small hinge on which our head is supported. So we need to be very careful because this is supported by just a small hinge here. And a lot of people get cervical issues as they age. Why? The reasons I listed you. And if you do these exercises regularly, you can do this almost daily also. Then gradually you will see improvement in the next 2 to 3 months. Your pain will gradually start improving, your range of motion will improve, and the muscles will also become stronger. Okay. Next exercise, we will do this supported. So what we have to do, take your ear to the shoulder this way. So I've also a restricted neck because of my arthritis. I also had arthritis in the past, as you know. And what we will do, take our ear to the shoulder, lift the same hand. So I'm taking my right ear to the right shoulder, lifting my right hand, and just give a supported stretch here this way. Other hand you can take out. So left hand, if you are doing on the right side, your left hand in T shape. So somebody is pulling me there. So I'm feeling a good stretch in this part. You can hold this slightly longer. First, bring your left hand down. Slowly release. Be very slow, very gentle. Great. Change. Other side. Yes. Great. Smile on your face. Very important. First, bring your hand down. Very slowly release. So be mindful. I could see some of you body was tilting. No, body should be straight. Okay. It's only your neck. Come. Change. Once again. Take your time. Yes. Slowly relax and change. Normal breathing. Do not hold your breath and relax and release. So you can do on your own 2 times more. So just lift your shoulders. Others, just lift your shoulders and rotate. Again, release. Very important this thing. And relax. Now, if you don't have any pain or very less pain, then only you do this. If anybody has severe neck pain, do not do neck rotation, but neck rotation also, we will do half. We will not do full rotation. So what you do, just drop your head to the right, take it back. So make a semicircle, bring it to your left, and then from left, again bring it to your right. So I'm not taking my neck down. Okay, it's only half rotation. Everybody can start, but go very slow. Try and go deep. If you don't have any aches or pains, you can go deep. And relax. Just close your eyes. Feel the circulation, blood circulation in your the muscles, ligaments, joints, everywhere. Now, keeping your eyes closed, just take your chin up again, look up. And this time, open your mouth wide, like you're eating something. Open your mouth wide. First, close your mouth there itself, then come back to center. So naturally, you will feel a lot of stretch in your throat, in this part of your neck, the front part. Here, you will feel a good stretch. Everybody feels that? Show me a thumbs up. Yeah, when you open your mouth wide. But again, be very gentle. If you have severe pain in your neck, please don't go very deep. Okay. So what you can do, suppose someday you have pain. So just do this. Half up. So see, this part naturally gets a stretch. If you don't have pain, look up. Inhaling, look up, open your mouth wide, close your mouth, and come back to center. One last time. Inhale up, open your mouth wide, close your mouth, and center. So this also can be done 3 to 5 times. So this is all about neck movement. That's it. This is about more about flexibility. Now, next we are going to learn just one more exercise today. Rest I'll cover in the next live sessions what we do. This is about strengthening your neck muscle. Okay, so you need to be very mindful. First, see. So I'm just interlacing my fingers this way, placing it just below the, just above the neck. Okay, I'm not keeping it on the neck. Okay, just place it here on the neck. Okay, now what we will do, it's a tug of war between your hands and your head. So my head is trying to go back and I'm resisting with my palms. I'm trying to push back, push back, push back, but no, my palms are resisting. Slowly relax. So when I'm trying to push, that is pressure on, and when I say pressure off, you just slowly release. So if I show the side angle this way, you can look to see. Now it is neutral. It is pressure off now. When I say pressure on, I'm just pushing my head back and resisting with my full strength. Let's see who wins the tug of war, whether the hands or the hand, but it should be stable. It should neither go back nor in front. Look at my muscle, how my biceps are engaged. Pressure off. So you don't release your hands. Hands are there only. Pressure off means you stop pushing back. Stop resisting with your hands. Just stay there. Once again. Inhale, pressure on. Exhale, pressure off. Continue 2 more times. Inhale, pressure on. Exhale, pressure off. One more time on your own. Let me check. Yes. So what this will do, this will strengthen your neck muscle. This is the gold standard exercise to strengthen your neck muscles. We will do a lot of exercises going forward, but this is a very simple basic exercise that you can do anywhere. You don't need anything. You can do in an airport, you can do wherever you are in your office. Also, sometimes you miss your exercises in the morning because of some XYZ reason. So you can do this in your office, you can do that at night before sleeping. It's very gentle on the neck. If you feel strain after doing this, sometimes it may happen, just take a warm shower. So that will help you release all the tension. So this was all about neck. But since I said neck is not only about neck, it's also about your trapezius. So I'll send in the on the WhatsApp what a trapezius is. So basically this part. If you look here, this part, these are shoulder blades, the two big bones that you can feel, and the triangular muscle that starts from here goes down till here. So it's like a diamond shaped muscle which is supporting your cervical spine. So the key to having this thing relieving of neck pain is also strengthening your trapezius. Okay, so for to strengthen your trapezius, first we will do activation of the shoulders, because it's the shoulder joint also that is involved. So we'll do very few basic exercises for the shoulder. So just take your hands wide, bring it to your shoulders. One, two, three, four, and five. Now bring it close, elbows, and take it wide. So exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, and relax. So this was one way to activate your trapeze. Next is just take both your hands forward, palms facing down, all the five fingers together. All the five fingers together. So what I'm doing, I'm keeping my elbows straight. Nowhere during the exercise, I will bend my elbows. So what I'm doing, I'm just retracting my shoulders a bit this way. Retract, protract, retract, protract, retract. So hands will be shoulder level, not above the shoulders, not below the shoulders. Don't lift your shoulders up. It's just retracting and relaxing. Retract. Everybody give me a side angle if possible, so that I can correct you. Geeta, start. I'm looking at you. Yeah. Great. Super. Let me check. Last two. If your shoulders are paining, you can relax. Otherwise, continue. Yes. A very good way to activate your trapezius. Last one. Perfect. Everyone perfect. And relax. Just relax for a while. Close your eyes. These exercises have to be done in a very relaxed way. Never be in a hurry. Come. Again, take your hands in T shape. This time, palm facing up. Then bring your fingers to your shoulders. Now we will do shoulder rotation. So just take your hands up this way. So your bicep should be close to the ears. Then take it back and down. We can do this with breathing. So first half would be inhale. So inhale and exhale. Inhale, exhale. Continue. Last three more times. Inhale, exhale. Two more. No, one more. And relax. Try to sit straight like I taught. Don't drop your shoulders. Just sit straight, shoulders chest out, shoulders slightly rolled back, elbows close to the body. So this is the posture you should try and maintain throughout the day. This will also strengthen your core muscles going forward, because you are lifting from your core. When you are sitting, you are lifting from your abdomen. Upar ki taraf. Okay, just sit straight like this for some time. Next exercise, what we are going to do, we are going to strengthen our shoulder muscles and our trapeze. But be very mindful, if your shoulders are paining, do less. So I don't have any awards and certificates to give to anyone to be able to match my stamina. Stamina is built over time. So the rule for muscle is that use it or lose it. But when you start using it, go very slow. So it's like a house help or an employee. So he has been sitting and eating for the past 50 years, and now you give him a lot of work. So naturally he will resist. Okay. Similarly, your muscle. When muscles will resist initially, it will cause some pain, some discomfort. Go slow. So give him small work. Okay. So let's start with maybe five counts. We'll start with five counts, and gradually over the next 3 months or few months you are with me, we will just build up the stamina. Okay. So I'm just shifting back slightly. Am I audible from here? Great. So just take your hands up this way, like you're blessing someone. Okay. So here my shoulders and elbows are in one line. Now slowly take it up. Your fingers should kiss each other and then come down. One, two. I just turn the camera slightly up. And then you can look at me. Yeah. See, three. Very slow. Two more. So Priya, just look at me once, my palm position. Forward. It's like this way. My palms are facing forward only. It's not turning inward. No, do this. Yes. Come down. It's good that we have a small group, so corrections are better in a small group. 5 and relax. So we did very basic, only 5 counts. You can definitely do more counts if you want. Okay. We'll just repeat this one more time for the group. Okay. But let's go slow. Many were going very fast. Be mindful that what is happening in your shoulders, in your trapeze. Now you know a new muscle in your body. So it's all about education. Once you know, you'll be able to take care of it better. Hands in blessing position. Slowly go up. Very slowly come down. Up, down, up, down. Two more times. Up, down. Very slowly up and down. Now, from here, bring your right hand and just clap your left. Come back and change. You feel a good opening in your upper back. Continue. Don't worry if you are not able to reach. How much ever you are able to reach, do that. Yes. This will also give good mobility to your trapezius and your upper back. The upper back supports your neck. It's not only you have to work out your neck, it's also your upper back that you need to strengthen. Continue. Last one. And relax. So naturally you will experience a slight pain in your shoulders when you do this. Just be with it. Again, we can do the shoulder rotation. Just lift and rotate. Slow. Change. 2 and 3. Relax. Now you get a big towel with you. Everyone get a towel. We'll do this standing. Is my voice clear from here? Am I audible? Great. So what we will do activation of the shoulder muscles. So hold it slightly wider. Okay, take a big towel, hold it slightly wider. Okay. So what you can do, see, this is the full range of motion that I'm doing. The full range of motion is you take it up and take it down without bending your elbows because my shoulders are very flexible. Okay. If you are not able to do this much, just take it up and back as far as you can without bending your shoulders. Sorry, without bending your elbows. Don't bend your elbows. You can do only this much also. Half is also fine. This is also fine. And this is also fine if you are able to do. If not able to do half. You can only lift till here and then come down. This is also fine, but be very mindful not to bend your elbows. I can see some of the elbows are bending in the quest for going down. No, you will hurt yourself. No. So Priya, don't go full down. Do only this much. Or maybe you can hold it slightly wider, take a big towel, hold it slightly wider. But please don't bend your elbows. See, I'm also doing half. So no problem. Yes, come back. No, yeah, no. Don't bend your elbows. I'm looking at you. Yeah. Dolly perfect. Anshu perfect. And Gandhi perfect. And Yamavi perfect. Yes. Last one. And relax. One last exercise, just one last exercise we will do. So you hold your towel slightly closer now. Okay. So this is slightly wider than your shoulders. Previously, we were holding it very wide. Now you're holding it closer. Okay. Just take it front, chest level. Okay. Now you have to tear it apart. So just put all the pressure, you're trying to tear it apart this way. And just hold. You will see your upper back is getting activated. Okay. Now holding this, Just bring the towel close to the chest. Be mindful of your elbows. Elbows should not drop. Take it forward. Try and maintain that pressure that you have to tear apart the towel. दो टुकड़े कर देने उसे. Again, bring it closer to your chest this way and take it front. So when you bring it back, you squeeze your upper back. Upper back को हम squeeze करेंगे. Yes. Super. Two more times. Last one. And very slowly bring your hands down. So let's not do it too much at once. It's been already, sorry, 35 minutes. We have been practicing 38 minutes. We have been practicing. So once you keep doing this regularly, you will start noticing change within a few days. That yes, your muscles are getting toned up. See, we didn't use any dumbbell or we didn't use any resistance bands yet. We will do that later on. So I would request everybody to get a resistance band also, if possible, and this will really help you. But see, if anybody watching this recording have a severe shoulder, frozen shoulder, or severe cervical, please do it under the guidance of a professional because this is meant for someone whose condition I know. And please don't try to like copy everything; it can hurt you. Also, questions I'll take after the recording stops. We will take up the questions. Just one last thing. As I said, managing stress is a very important part if you want to release. Because see, where is the most tension stored in our body? It's this part only. When you take a massage, what a masseur does, he releases, there are knots here. Certain knots are formed here, which the masseur puts pressure. He massages a lot in your trapezius also. So yes, if you have any kind of stiffness here, massage is a very good way. So I would very strongly suggest do some self massage daily, daily self massage, either before shower or after shower, whatever is comfortable for you. So just take some since it's winters now. So take some sesame oil in your hand and just apply it to your joint, your shoulders this way. It should take about 2 to 3 minutes of your time. And once in every 15 days, just go to a spa or called a masseur at home if possible. I don't know what is there in Dubai, but yeah, definitely spas must be there. Just go to a spa and take a full body massage. So massage has a lot of benefits for your joints, for your muscles, for your blood circulation. It will really help you in maintaining the skin quality also. Okay. So I took a massage yesterday. I take a massage every 7 to 8 days because of my bio individuality. I had ankylosing spondylitis, if you must be knowing now. And in this, there is a protocol that I have to take a massage every 8 to 10 days just to release all the stiffness and all the inflammation. It is therapeutic. Okay. So let's start this self massage daily and a professional massage maybe once in 15 days. This everybody should do. This will really help you in getting off medications. And if you're not on medications, it's a good preventive way also. So let's practice some breathing exercises that will naturally help you bring your stress levels down. Okay. So just sit with your back supported if possible. If you want, you can keep your back supported also, or you can sit without support if you're comfortable. Again, how do we sit? You roll your shoulders back, take your chest out. Chin should be parallel to the ground. So don't look into the screen right now. Keep your chin parallel to the ground and close your eyes. Start by taking your attention to your breath. Do not try to control your breathing at this time. Just be. Just notice your breath. We will practice something known as Brahmari, which is the humming sound. I'll show you once, then you can practice. So you inhale on the spot And exhaling, you do the humming sound. Mm. And feel the vibrations in your neck, in your shoulders, and practically every cell of your body. We'll do this two more times. Inhale. One last time. Inhale. So when you're practicing on your own, you can do this up to 10 times also. But again, don't stress yourself too much. This is actually for relaxation. And this also strengthens your vagal nerve, your vagal tone. This will improve your vagal tone. So vagus nerve is the nerve. You can open your eyes now, which connects your brain to your gut. So there is a two-way connection between the two, and it also connects you to several other organs too also. So your vagus nerve, that vagal tone will improve, and it will help you relax also. This pranayam you can do before sleeping also. It will help you sleep better. Okay, so I'll stop the recording now. Thank you very much.